Again, I want to tell everyone thank you for being here and for being supportive of these efforts and helping us bring all of the stakeholders to the table so that Arkansas can not only address this problem, but we can lead our nation in how to fix it. So thank you for being here. And with that, I'll take a couple questions. And I am going to warn you ahead of time, I'm probably going to do that quickly because I think we are testing fate with a few of our visitors, and their moms' arms are very tired. So I will open it up, and if you guys have any questions, happy to take those now. That's a part of what this team that we are putting together through the executive order is going to work on, but we want them to get started immediately. They've already been working closely to put some of that messaging together. I think what you see here today, healthier women, healthier moms, healthier babies, those are the types of things we want to focus on. We don't want to just look at women during 12 months of or 9 months of their life. We want to focus on the entirety of women's health, and I think by bringing all of these stakeholders together and really educating women, we're going to be able to do that.
So about the 12-month expansion, I think it's great that so many states have done it, including a number of red states and a number of Medicaid expansion states. So what makes Arkansas different, and why have other states seen this as an opportunity they should?
Yeah, so every state has a different setup and different coverage. Our healthcare system looks very different than all 49 other states. No two states have a similar setup, but Arkansas already offers that coverage 60 days postpartum, and then we want to make sure that we are transitioning women to coverage that already exists in the state. I don't believe creating a duplicative program just for the sake of creating a program is actually going to fix the issue. We already have so many women who aren't taking advantage of the coverage that exists. Creating more coverage doesn't get more women to the doctor. Having those women actually go and see their healthcare provider, that's what we have to focus on, and that's really what we're trying to do and the solution we're trying to put forward with this group.
So does Arkansas have coverage options that say the other states that have embraced it do not right now?
We do have coverage options that are available that would cover women certainly up to that 12-month period. One of the other things that I think is a big point of confusion is that even if you expanded that coverage at the end of 12 months, you're still having to transition those women to another type of coverage. We're just trying to do that sooner so you're not having to do it multiple times. It is, and that's been, the goal of this administration. When I ran for office, I was very public about the fact that we are going to work closely, and I'm very proud of our cabinet and how well they have done in helping us tighten our belt. And government growth has to be slowed. If we want to continue to do things like phase out the state income tax, then we have to stop the growth of government. And on average, that is about 3%. I'm proud of the fact that our budget is 1.76% growth this year, while still being able to aggressively invest in the key priorities of this administration, like education, like public safety, our parks, and our rural areas. So I'm really proud not only of our ability to focus on these key priorities that I know are going to change the state, but to do so without exponentially growing government is a big win for Arkansas. I'm sorry, I'm not following the question.
What have you expected that through this committee, the new changes implement maybe how the state handles Medicare? Can you expound what you meant by that?
On this specific group that we're establishing through the executive order, they're going to look at every option on the table. So one of the things that already exists, the Maternal Mortality Committee, and they're going to be working in close partnership with that group. That group largely helps gather data and research, and this group that we are establishing through the executive order will be focused on the implementation side, and so it'll be a great partnership. We've got Dr. Greenfield, who's been part of that committee, and they're going to look at all options on the table, but specifically focusing on those 4 priority areas that I laid out. That's a question you'd have to ask them. I'm not specifically part of the committee. I do know that coverage exists. We want to make sure every woman has coverage, and that is currently available in Arkansas. But again, coverage does not equal health care. We have to make sure that these women are actually going and seeing a doctor. When we have 1,100 women in the state of Arkansas that are not seeing a doctor, that until they go into labor and give birth, that's a problem. And that's something that we can address, and something I know collectively we can do a better job on. I think one of the things that I would be remiss, and we'll wrap here, is that if you don't take a second to look around this room and see the variety of people represented, this is a collective effort. We have people from the public sector, the private sector, the nonprofit sector, all coming together saying this is a priority, we will work together and we will fix it. That is a big deal for the state of Arkansas. It's something that we haven't seen in the past, and I'm really proud of the fact that we have stakeholders that normally don't always work together that are represented here in this room. I think it shows the level of commitment, but I think it also shows that we're going to get the job done. So thank you for being here today. Thank you again for those who are working so closely on this issue. I know Arkansas can change our trajectory, and certainly we can do a better job taking care of our moms. Thank y'all so much.